Hello and welcome to this screencast on impact of training on lifestyle diseases. So what we need to be aware of is the effect of training on lifestyle diseases such as cardiovascular diseases and respiratory diseases. So the cardiovascular, we're going to be looking at coronary heart disease, stroke, atherosclerosis, heart attack, and for respiratory system we're going to be looking at asthma and chronic obstructive pulmonary disease. So first of all, these are the type of questions you may get asked on lifestyle diseases. 4 marker here, I'll let you read it, and then we've got a 10 marker here as well, so it can be one of the extended kind of questions on the A-level paper. Right, okay, so cardiovascular lifestyle diseases, please get these down, get good questions for them. Again, I've got some questions for you, however, please create your own. First of all, atherosclerosis. Okay, so what is it? Where does it happen? And what is the effect? So atherosclerosis is a build-up of fatty deposits, LDLs, okay, low density lipoproteins, but you can just put build-up of fatty deposits, okay, around the coronary artery wall, and it leads to narrowed lumen of the arteries. So this is a normal artery. This is normal coronary artery, which is on the heart. It feeds the heart with oxygen. So this is a normal one. And this is one that is suffering from atherosclerosis. So it's the build-up of fatty deposits around the coronary artery wall, leading to a narrowed lumen of the arteries. Lumen is just this little bit, circular bit here. So that's atherosclerosis. We've got coronary heart disease. Coronary heart disease is a term for all diseases of the heart, to be honest, but we'll go through the what, where, and the effect of coronary heart disease. So first of all, this is linked to atherosclerosis. So coronary heart disease is caused by atherosclerosis, which is the narrowing of the coronary artery. The effect is this will cause high blood pressure, also known as hypertension. Okay, so coronary heart disease, this coronary artery, the arteries that feed the heart with oxygen, and again, these are those fatty deposits, which is known as atherosclerosis. So atherosclerosis is the build-up of fatty deposits on the coronary artery walls, causing a narrowed lumen of the arteries. Coronary heart disease is caused by atherosclerosis. It's the coronary artery that gets this build-up of fatty deposits, and it causes high blood pressure. We also have heart attack. So what, where effects? We've got the complete blockage. So this isn't related to atherosclerosis. This is the complete blockage of the coronary artery, and this is damaging to the heart muscle and can lead to potential death. Okay, so it's a piece of kind of fatty plaque, and this almost like breaks away from the arterial wall in the form of a blood clot may form from this. And if the clot suddenly kind of blocks an artery, it can cut off the oxygen supply to the area, which causes damage to that area and potentially death. Then finally, we've got stroke. So stroke is caused by one of two things. So first of all, what, where effect? Stroke is damage caused by lack of oxygen to the brain cells. Okay, so it's when we get a lack of oxygen to the brain cells. And the effect of this, we've got an ischemic stroke or hemorrhagic. Okay, so ischemic is blockage of blood to brain, and hemorrhagic is bleeding in the brain. So one is a blockage of blood to the brain, and the other, hemorrhage, is bleeding in the brain. So they're two different types of stroke we have. So atherosclerosis, coronary heart disease, heart attack, and stroke. So respiratory lifestyle diseases now. So we need to be looking at asthma as well as COPD. So asthma, what, where effect? So asthma is the constriction and inflammation of the bronchial airway, leading to breathing problems. So this is a bronchiole, that's alveoli at the end where gaseous exchange take place. This is a normal airway, this is an asthmatic airway, and finally this is what happens when there's an asthma attack, so it goes even narrower. So basically we can get less oxygen to the alveoli, therefore less oxygen gaseous exchange, so forth. COPD, chronic obstructive pulmonary disorder. This is an umbrella term, okay, so what, where effect, what, it's an umbrella term used for the constriction or inflammation of the lungs and respiratory airways. The effect of this, if we have COPDs, there's an inability to exercise, and it's just a decreased quality of life. Walking up the stairs is a struggle, walking to the shops is a struggle. Okay, it's just a decreased quality of life that we have. So they're respiratory lifestyle diseases. Finally, we need to know, or we need to be able to evaluate the advantages of exercise on our lifestyle. Okay, so that's what we're doing now. First of all, we need to know the basic fit principles to training that are going to help prevent lifestyle diseases. So frequency, 3 times a week. Intensity, 60 to 80% of heart rate max. We can even go up to 50%, to be honest, 50% to 80% of heart rate max. Time, 30 to 40 minutes. Type, we're looking at continuous training here, jogging, swimming, cycling. Okay, so this is really linked to obviously cardiovascular, aerobic, so it's very similar. So 3 times a week, 60 to 80% heart rate max, 30 to 40 minutes, continuous training, for example, jogging. So what advantage is this going to have on the cardiovascular diseases? So positive effects of exercise on cardiovascular diseases. This decreases low density lipoproteins. This is basically cholesterol. Okay, so these low density lipoproteins are cholesterol, and this is what causes the fatty deposits on the coronary arteries. The reason this decreases is because we have an increase in high density lipoproteins. High density lipoproteins are good fats, and these chip away at the LDLs. Okay, so it decreases the amount of low density lipoproteins. We get a decrease in resting blood pressure. This or both of these lower the chance of coronary heart disease, heart attack, and stroke. So we also need to know the positive effects of exercise on the respiratory diseases. Okay, so we've got increase in resting the submaximum breathing rate, increases our lung volume, specifically tidal volume and minute ventilation, therefore lowering the chance of asthma and COPD. We do have more advantages in terms of links to aerobic capacity training, which we need to go through. I also need to go through the negatives as well, which we'll do in lesson. So make sure you've got good notes on these for me, and I'll see you in lesson. Thank you.